Okay, we're going to be looking at episodicity and what that may give you information about when you're examining the patient. Let's define it first. This is not, I have pain in the morning when I get up, the pain goes away at 11 o'clock, I work all day long, and then it will come back at night. This is not how I'm defining episodic, although you do get information from that. What I mean by episodic is that they'll have pain for a varying period, prolonged period, days, weeks, and then they'll have a period of days or weeks without any pain at all, and then it will come back again. This is what I mean by episodic. When you have that type of pain, the one thing you can say, if this has gone on for any length of time at all, is it's not going to kill the patient. So I don't think you have to worry too much about serious pathology here. As opposed to, say, a 60-year-old man who for the first time in his life gets back pain. That's much more likely to be due to a serious pathology than is episodic pain that this 60-year-old man has been having for the last 10 years. So this is the first information you can take away from it. It's not likely to be serious. We can have it getting worse, which it usually does. We can have it getting worse by increasing its frequency. So it may come on the first time for a month, or rather it will come on for a couple of weeks and then go away for 3 months. And it will come on again in 3 months' time, and it may last 3 weeks, and it'll only go away for a shorter period. And so what you see is the tendency is for the episodes to get longer and the gaps between episodes to get shorter, until actually that may well join up, and so you have ongoing pain, continuous pain. Or it can increase through intensity. The pain gets worse with each episodes. That may indicate you've got something progressive going on. There may be some form of collagen disease, but it's probably not within our ballpark. So going into the rest of the exam, you have to keep that in mind and basically try to disprove the hypothesis that you have a non-musculoskeletal problem going on that belongs to us, as it were. It can stay the same, so it doesn't get worse, it doesn't get better, it's a little bit rare. Now, the most likely cause of episodic pain in our clinics is biomechanical dysfunction. And this is one of the hallmarks of it, in that short duration episodic pains is one of the essential ill descriptors of biomechanical dysfunction. So it's likely to be a biomechanical dysfunction. If so, the increase in frequency would strongly suggest that the instability is getting more unstable, and the chance of you getting this better is getting worse with time. The chance of rehabilitating this with stabilization exercises and muscle and neuromuscular rehabilitation exercises is also getting smaller all the time. But you haven't got one choice. This is what you've got to try to do. But the prognosis isn't as good. This biomechanical diagnosis link, biomechanical dysfunction link, is particularly true if this episodicity is coupled with the other characteristics of biomechanical dysfunction found in the essential illness script. Moderate pain, non-obligate impairment, moderate referral, if any, flexion or extension impairment dominating the picture, and range of motion will also show flexion or extension loss and pain. And then it looks like a biomechanical dysfunction. So the first thing you take away from this is the fact that it's not going to kill the patient if it is episodic, and it's been ongoing for a while. The second thing is that it is one of the defining characteristics of biomechanical dysfunction, or at least typical biomechanical dysfunction, and so your mind is moving towards that as a diagnosis. Now, it's got to be said, there has to be a first episode with biomechanical dysfunction, and that's usually coupled with higher levels of pain than subsequent episodes. So if you're seeing the first episode, there isn't a history of episodicity. So your decision, this is a biomechanical dysfunction, becomes that much more difficult. Okay, so episodic or non-episodic. Take care. Bye.